And so if we look at Humacyte's pipeline, we see that they've already got platform validation in the sense that they have their first FDA approval for Symvess for the vascular trauma indication. They have their first real commercial product, and on top of that, they have interest from military. Humacyte announces publication of long-term results for Ukrainian patients treated in real-world combat setting with Symvess. And we can see that after 18 months of follow-up, patients were observed to have 0 infections, amputations, or deaths, and a high rate of patency. And these results suggest that Symvess is actually highly effective in allowing blood to flow freely over time. This news comes after Humacyte sent shipments of Symvess to Ukraine as part of humanitarian efforts. Battlefield vascular injuries are some of the most difficult for surgeons to treat because of pressure and the potential for infection. Unlike traditional autologous vein grafts, which require harvesting a patient's vein during surgery, Symvess is designed to be immediately available off the shelf, saving critical surgical time in wartime situations. Symvess has also shown low rates of infection. We've also seen the Pentagon allocate funding for the use of Symvess too. The US Department of Defense funding for procurement of bioengineered blood vessels. The US Department of Defense Appropriations Act includes dedicated funding to support the evaluation and incorporation of biologic vascular repair technologies for the warfighters suffering from traumatic vascular injuries. On top of that, we've seen recent news that Symvess is now under contract with the Strategic Acquisition Center of the US Department of Veteran Affairs. And this is significant in the sense that this contract makes Symvess more easily accessible to 170 VA hospitals. These VA hospitals are for anyone who has served on active duty in the US Armed Forces. Symvess has essentially been added to its preferred purchasing system, meaning the product is now much easier for VA hospitals across the country to access and order. Before being added to this, Symvess would have had to go through a surgical committee review, product analysis, value assessment, and procurement vetting. So this acts as another layer of institutional validation beyond the FDA approval. This reduces friction for future adoption too. Humacyte have also had the marketing authorization application for Symvess in Israel accepted for review. The Israel Ministry of Health has accepted Humacyte's marketing authorization application for Symvess, in turn initiating a fast-track 180-day working review process based on the existing FDA approval in the US. This news is significant simply because it validates Symvess outside of just the US and accelerates potential commercial expansion beyond the US too. And they're also exploring possible expansion into Saudi Arabia as well, with a purchase commitment for clinical evaluation and an outreach program in the Kingdom of Saudi Arabia. In March 2026, Humacyte received a minimum purchase commitment of $1.4 million of Symvess to facilitate a clinical evaluation and outreach program in hospitals within the Kingdom of Saudi Arabia. The planned clinical evaluation program is to be conducted in parallel with ongoing negotiations with a Kingdom of Saudi Arabia based entity for establishment of a joint venture and license to commercialize Symvess within the country. And so with this in mind, we can see that there are numerous conversations taking place at the moment. It's really important to understand that this strategy, this expansion strategy, is very much in its infancy. You know, for example, with the discussions in Saudi Arabia, we've not yet experienced an approval, and this is a process which is taking place right now. This discussion, this 1.4 million deal, to help build awareness and understanding of Symvess before a potential approval in the future. And so this map serves as a global overview of where Humacyte are with the expansion of Symvess. Conversations and rollout are still very much in an early stage. The only country with approval for Symvess right now for the vascular trauma is in the US. Israel could potentially become the next country to approve Symvess, with a decision potentially arriving in late 2026 or early 2027. Saudi Arabia appears to be at an earlier stage, with current efforts focused on clinical evaluation programs, hospital outreach, and a commercial partnership discussion, meaning any potential approval would come later and remains uncertain at this stage. And with all of this in mind, I've alluded to this in the last video, where one of the things to be mindful of is that this is not something that can be easily administered to patients. Like we can see with the example in Saudi Arabia, you know, it requires a lot of discussion. It requires training, it requires physician education, hospital onboarding, and real-world experience before it can be rolled out globally. It will take time to be administered to patients. It's not something that can be administered very quickly, you know, like an intravenous injection, for example, and monetized very quickly in that way, because there is this need to train medical staff. And because of this lag time between the approval of the treatment by the FDA and the need to upskill and train medical staff, sales haven't been as fluid as desired. As a result, even with regulatory process and growing international interest, which we've seen on this map, commercial uptake may be gradual rather than exponential in the near term, and this is something which is really important to be mindful of if you're considering an investment in Humacyte. And so in the next video, I'm going to go into a bit more detail around some of the other expansion plans that Humacyte have. Naturally, I'll keep you updated on the other stocks that I track on this channel. Thanks for watching, have a great day, and I will see you in the next one. Take care.